14th of November is recognized as World Diabetes Day. It is a day set aside to raise awareness about diabetes, its prevention and its impact on health worldwide. It was established by the International Diabetes Federation and World Health Organization in response to the increasing cases of diabetes around the world. The theme for this year focuses on access to diabetes care, ensuring that every person with diabetes has the support, medication, and knowledge they need for proper management. Our topic for today is diabetes prevention and management, spreading the knowledge about the lifestyle choices, diet, and exercise. For now, we are going to know what the health policy plays on the crucial role in shaping the management and the care of chronic conditions like diabetes. Welcome to Health 247. My name is Irene Okechukwu, your host as usual, and today I won't be taking you through, for I have a health practitioner who will take us through on this very topic. And if you want to be part of the show as usual, you can just sit back and keep watching us on Rapid TV channel 176 on StarTimes, or you can follow us on all our social media handle on official Rapid TV. So we're going to go on a break, and when we return, I will be introducing our guest to you. So sit back and relax. Alright viewers, welcome back on this break, for we are going to be talking about diabetes. So I hope you're going to sit back and get something to know. So I have with me today a health practitioner, a doctor, and she has wealth of knowledge in diabetes. So she says she must come and talk, that this is her time to talk. Well, what will I say? My own is to sit back and get knowledge from her. She is none other than Dr. Eberechi Osokwa, and she works with Lini Hospital. Madam, you're welcome.
Thank you very much.
All right. How have you ever been on the program Health 247?
I'm glad to be here to spread as much awareness on diabetes as much as possible.
Interesting. So can you take us through on this topic, diabetes?
Okay, so diabetes, first of all, is a chronic metabolic condition in which the body either has a problem producing enough insulin. Insulin basically is a hormone produced by the body that controls the blood sugar. So either you have little or no production of insulin, or there is an inability of the body to use the insulin which is produced in the body, which is what we call insulin resistance. So that's basically diabetes in a nutshell.
Okay. So can you just tell us a bit on the prevention, or how we could prevent diabetes? Because they say that diabetes is not just for elderly people. Like when people say, I have diabetes, so how old are you? So can you educate us more on how diabetes can just come about, and what are the preventive measures?
Okay, thank you very much for that question. So first of all, diabetes can be divided into two main types. We have type 1 diabetes, we have type 2 diabetes. So type 1 diabetes is basically what we call an autoimmune condition in which the body fights its own cells that produce insulin. So basically the insulin producing cells are fought by the body. We call it autoimmunity. So when that happens, the body cannot produce enough insulin. So that kind of diabetes is basically is something you can't actually prevent. Then we have the type 2 diabetes, where the body produces either little insulin, or the body produces enough insulin, but the body isn't able to respond to that insulin as is required. So in that case, that particular diabetes can be prevented, because you can actually help the body to respond well to the insulin, or you can prevent the body from having issues with the insulin response in the first place.
Interesting. So what are those symptoms of diabetes and the risk factors associated with it?
Okay, so the symptoms that we look out for when someone has diabetes are, first of all, we look for increased thirst. So when the person is constantly drinking a lot of water is one of the symptoms we look out for. Then also increased urination. Obviously, when you drink a lot of water, you pass a lot of urine. And also because you have this you have a lot of sugar in your body. So the body tries to clear out that sugar by producing a lot of urine. So also at night, they'll tell you, okay, I wake up like 4-5 times at night and I urinate a lot. And also we have increased hunger where they eat a lot of food.
Wow.
So that's also another symptoms we look out for. Then we have fatigue. They'll tell you, I feel tired easily. Or they'll have blurry vision where they can't see properly. They don't really see as clear as they usually did before, rather. So we also have where a particular kind of experience where they are unable to tell if they have injuries, for example, or they have reduced sensation, especially in their feet.
Wow. Yes. But when you just mentioned something of they are not aware of their injuries.
Yes.
Is it that their body becomes they don't feel pains anymore, or their body becomes painless?
Well, the thing about diabetes is that because of the increased amount of sugar, it kind of damages the nerves.
Okay.
So when the nerve is damaged, that sensation that you normally receive when you touch your foot, or when you, for example, if you step on something sharp,
you feel it immediately.
You feel it, yes. But because someone has diabetes, they may step on something very sharp and they won't tell you. It's only until it has become a full-blown ulcer that they'll be able to maybe recognize, or maybe someone else may see. But throughout that period, they won't be able to tell you that they feel anything.
Wow.
Yes.
What in terms of if they have injuries, does it heal on time?
No, they have delayed healing.
Wow. Why?
Because of the immune system is basically affected by the high amount of sugar in the system.
Okay.
So because of that, the body, and then also, like I mentioned, the nerves are not able to sense these damages that occur. So the immune system is also affected, and then because of that, they won't be able to heal as quickly as they should heal.
Okay, so moving forward, what are those basic treatments for the type 1 and type 2 diabetes?
Okay, so there are some treatments that are common for both of them. For example, you have to monitor the sugar in both cases. So you see, most of the times when patients come to us with diabetes, we ask them to get the glucometer, which is a device that measures the blood sugar.
How do you do it?
So basically, they will get strips, and then they will get a needle or a lancet. So it's just basically a pen that contains a sharp needle in it.
Oh wow!
So, and then they will have the glucometer machine. So when they prick themselves with the lancet and they use the strip to collect the blood sample, they put it in the machine and it gives a reading of how much sugar they have in their blood. So if it's done in the morning, it's fasting blood sugar. If it's done anytime from 10 a.m. and after eating and so on, it's called random blood sugar.
So the random blood sugar, what does it mean?
Random blood sugar just basically means that, for example, the person has eaten food. For example, if you wake up in the morning, we call it fasting because you've not eaten for 8 hours or more. But if you've eaten, we call it random. But also, if it's past 10 a.m., let's say you woke up early in the morning and it's past 10 a.m., we also call it random because by that time the body produces hormones that counteract insulin. Just to start your day up normally. For example, cortisol, adrenaline, glucagon, hormones like that.
Wow, interesting. So moving further, as we're going faster and faster, but the topic is getting interesting. So can you explain the differences between the type 1 and type 2? Because some people do not even have idea of which one is type 1 again, which one is type 2. They'll be like, maybe you go to the hospital and the doctor diagnose that, you have type 1 diabetes. Like, is it serious? If they tell you it's type 2, you'll be like, maybe it's not serious. So help us differentiate what type 1 and type 2 diabetes is.
Okay, thank you very much. So type 1 diabetes, like I already mentioned, is an autoimmune disease. So it usually happens at a very young age. So maybe like a child, maybe there's a teenager or just an adolescent comes to you and they're having symptoms that will make you think of diabetes. So basically, the body has issues with production of insulin because damages the cells that produces insulin.
Okay.
So it happens at a very young age.
Okay.
While type 2 diabetes is when, for example, there is reduced response to insulin, or there is inappropriate response. So the response basically is not enough.
Okay.
Yes, and that happens, like I mentioned before, because if someone, for example, eats a lot of sugary foods, and the body continuously produces insulin. Continuously, the body will eventually, how will I say it, down regulates the receptors. For example, the receptors that were there before will be reduced because of the insulin is producing is too much.
Okay.
So because of that, the body will not be able to respond as much.
Okay.
The amount of sugar produced will be too much for the amount of receptors.
Okay.
So there will be an overflow of sugar in the blood.
Wow.
So that's type 2.
That's type 2.
Yes.
So between type 1 and type 2, which is dangerous?
Both of them are equally as dangerous,
wow.
but type 2 is preventable.
So the type 2 now, because I know that there are some children who are obese, they say they have diabetes, and some pregnant women, for instance, let me just give myself use myself as an example. If I am pregnant and maybe I don't know whether I'm obese or something, and I go to the hospital and the doctor checks me, I run some tests and they tell me I have diabetes. What angle, like where do I fall in? Is it the type 1 or the type 2?
Well, if someone is pregnant and they have diabetes, we like to call that gestational diabetes.
Okay, it's temporal?
It's what?
Are you saying that it's temporal?
No, is it? Yes, it's kind of like a temporary state, because it's not like you're pregnant for the rest of your life.
Yeah, sure.
It's just during that pregnant period of time while you're pregnant that we call it gestational diabetes.
Okay.
But if it goes further than pregnancy, or it prolongs itself, then it will now be type 2 diabetes.
Okay. What about children?
Children, you give an example where a child can be obese and have diabetes. Well, the thing is that initially, children were known to, or were most likely to have type 1 diabetes.
Okay.
But the thing about type 1 diabetes is that most individuals that have it are actually slim.
Oh.
Yes. But type 2 diabetes is in more of obese people. So it's possible for a child to be obese and to have type 2 diabetes.
Okay.
Do you understand?
And it's curable?
It's a lie, like I said, it's a chronic medical condition.
Oh.
So you have to manage it for the rest of your life.
That's like a death sentence, you know. You'll be taking drugs all through your life.
No. That's the thing. The difference when we talk about management, there are different ways.
Anyways, you are reaching here. Yeah. All right, viewers, it's been Dr. Eberechi Osokwa who has been taking us through on this topic, diabetes and its effective management. So we're going to go on a short break, and when we return, we're going to learn more from her. So stay tuned. All right, viewers, welcome back on the short break. So over to you, Dr. Eberechi. You were talking about diabetes being a chronic disease, and probably anybody who has it is going to be like a lifetime something. Can you explain further? Because this lifetime something is what is scaring me. People like me, I hate drugs. And I'm not saying that those who have diabetes is more like a death sentence to them. That nobody prays for sickness, you know. Yeah. So are you saying that anyone who has diabetes cannot be healed? Like you just take a drug, doctors say take this drug and you'll be healed automatically and you will not see diabetes again. Are you telling me that it's not going to happen?
Well, it's very unlikely. Because diabetes is a chronic medical condition. So you have to treat it for the rest of your life. You know, so when we talk about treatments, it doesn't always mean drugs. There's lifestyle modifications, there's follow-up with your doctors, there's an integrated care process we go through with diabetes. So it's not just about taking medications.
Okay.
Yes. The most important thing, in fact, is the lifestyle modifications.
So can you buttress your point on when you talk about the lifestyle modification and tell us those effective strategies we should employ?
Okay. So the first thing you want to watch out for to prevent diabetes or to control diabetes is, for example, weight control. So being able to monitor your weight, being able to make sure that you're losing a certain amount of weight during a certain period of time is helpful. For example, if somebody has maybe a high blood sugar now that classifies them as pre-diabetes, but they don't want to enter the diagnosis of diabetes, simply losing weight can prevent them from becoming diabetic. So weight loss is actually very important. Then physical exercise, because one of the risk factors for diabetes is a sedentary lifestyle where you don't exercise. So exercising at least 10 minutes per day for at least 5 days per week is good. Yes. Then also having a balanced diet, or you can have a Mediterranean diet. You can have DASH diets where you have a lot of fruits, vegetables, grains, nuts in your diet plan to help to manage your, and reducing a lot of sugary foods from your diet is actually very important. That's actually number 4, avoiding sugary foods. Then number 5 will be avoiding stress. Anything that will cause you stress, that will predispose you to eating a lot of food, or that will increase your blood pressure, it also helps as well. So avoid anything like that. Then also avoiding smoking and alcohol. Excessive excessive alcohol consumption, smoking can also help prevent you from having diabetes as well, because these are basically what we call
lifestyle.
Risk lifestyle modifications to reduce both diabetes and the risk factors of diabetes. Because hypertension is a risk factor. But having hypertension does not mean you have diabetes. It's just a risk factor. But if you're, for example, obese now, the likelihood of is also a risk factor anyways. So just reducing those risk factors as well will help reduce your overall risk of having diabetes.
So you just mentioned on the nutritional value, that's the nutrition, the dieting. Now I want to ask you, how do you think nutrition plays a role to help prevent diabetes?
Thank you very much. Well, nutrition is actually one of the biggest things you have to watch out for when it comes to diabetes, because if you don't eat if you decide I'm going to eat only fruits and vegetables, or I'm going to eat low carb foods and go the rest of my life, the risk of you having diabetes is actually much less. So your nutrition plays a very big role. If you decide I want to be a vegan, or I want to be vegetarian, I'm going to avoid sugary foods, I'm going to avoid this type of maybe high fat foods, or
carbohydrates,
saturated foods, or carbs, something like that. The risk of you having diabetes is much lower, because the risk of you getting obese is lower, the risk of you having high cholesterol is lower. So the risk overall is what we are looking at. And if you reduce those foods that are going to predispose you to having a higher risk of having diabetes, then you will most likely not have the disease. So eating, like I said, DASH diets, Mediterranean diets, low carb diets is very good for the...
Interesting. So I believe you as a doctor, it's always challenging when you face or you diagnose your patient of diabetes, and trying to follow up and ensure that your patient follows the rules. So take us through on your journey as a medical practitioner. Tell us those challenges you face and how do you manage them, like your patients?
Okay, well, the most commonest challenge we face in the clinic is compliance. A lot of people find it hard to believe that they have been diagnosed with a chronic medical condition. They don't believe I have this for the rest of my life. Or I have to manage this for the rest of my life.
You see, well, that's the reason why I was telling you. You're telling me that diabetes is a lifetime chronic disease, and it's something that you will keep taking drugs. Like, how do you manage? If you tell me that kind of thing, I'll say you want to kill me.
Yes, I understand.
Yes.
But actually, I'm not trying to kill you. I'm trying to prevent you from dying.
I understand.
So if someone comes in and then you tell them, okay, you counsel them properly and appropriately, a lot of them still have that disbelief. They don't believe it. They'll tell you after all, because one of the risk factors of diabetes is also a family history of diabetes.
Yeah, it's true.
So maybe their mom has diabetes, their dad has diabetes, and they'll tell you, oh, doctor, it's not like I drink 10 bottles of Coke. It's not like I drink this. So some of them have these they are not able to believe that they actually have this condition
in their family.
Yeah, so when you give them medications, they'll take the medications maybe for 1 week or 1 month or 3 months, or maybe you give them for 1 month now, and they should you expect you give them a follow-up period of 1 month where they have to come back for a review and refill of medications, and they don't come back again. They feel they are cured now, especially if they stop urinating frequently. Remember those symptoms we talked about?
Even the urine will be smelling. Yeah, that's the truth now.
Yes,
it's so concentrated.
Yes. So even if those symptoms have stopped, they'll feel like, oh, doctor has cured me, I don't need to take my drugs. So that's the biggest issue we actually face. And another issue is ignorance in the like, because a lot of patients feel like as if they feel like as if it's, I won't say it's ignorance in the like in a way that makes the patient look like as if makes it look like as if I'm looking down on the patient, but they believe that, okay, once I pray, once I do this, God will heal me. The doctor is not God. Yes, but they don't believe that also the works you do hand in hand with what you're believing in will help you to achieve your goals. So it's important to also listen to your doctor properly, understand what they're talking about, and see the role you play in actually achieving your goals. Your goal is to what? Have good health.
Good health.
To live a healthy life. So if you're doing things that don't go hand in hand with those things, and you say that, oh, I'm praying, God will heal me, you're basically deceiving yourself.
That's true.
Because so it's like a kind of it's something that we actually face in I call it self-sabotage, really. But it's something we actually face in the medical field.
Well, lastly, every 14th of November is recognized as the World Diabetes Day. Like the UN, they've set aside this day to at least create awareness and other things. So what do you have to say on the commemoration of the World Diabetes Day?
Well, I'm actually happy that there's a day for diabetes, to give people awareness, to bring diabetes to the forefront, to help people understand actually what this medical condition is. It's a chronic medical condition. It's something that can be avoided once it's not type 1 diabetes, and it's something that can be effectively managed. So this diabetes we don't want it to look like this big scary monster that makes you feel like, okay, once I have it, I'm dead or something. No, it can be managed. It's something that we take care of. You will not die once you're in good hands. Once your doctor, your endocrinologist, or where your general practitioner is giving you the appropriate medication, monitoring your sugar control, as well as you also monitoring your own sugar control. So it's something we have to work hand in hand in. So this doesn't only bring to the forefront the disease, but also those people who have the disease, as well as those people who manage the disease. And it's us working hand in hand to make sure that everybody is aware of what this disease is and how all of us can effectively work together to manage this disease.
Interesting. Wow, it's been Dr. Eberechi Ozokwa from Cardio Care, also known as Limi Hospital. Thank you so very much for educating my audience, educating me, making me to know that diabetes is not a death sentence, but I should take my health serious, right?
Yeah.
Thank you so much for coming on the program Health 247.
You're welcome.
All right. So viewers, that's how much we can take on this very topic, diabetes, its prevention, its management, while we're trying to recognize the World Diabetes World Day, which is on the 14th of November. I hope you have learned something. As for me, I have done so. So we are going to keep posting you on updates on diabetes. For this is the first edition on diabetes and its management. So as usual, if you want to be part of the show, just keep watching us on Rapid TV channel 176 on Star Times, or you can go on our social media handle on official Rapid TV.